So we are really grateful to have you with us, Edgar Vega. You're the Senior Manager of Patient Advocacy with uniQure. So thank you in advance for answering all these questions for us. Now go ahead and start in.
Awesome. Yeah. And then just an FYI, so
Sure.
Lee Rushton, who is the clinical trial manager for the AMT 130 trial, is also with me as well. And I think we'll kind of be answering the questions like back and forth. So
perfect. Good. Even better. All right. So we'll start up. Is uniQure working on a potential gene therapy?
Yes. And the one thing that's important to highlight is that it's still in clinical trials, right? So it hasn't been FDA approved, but that is correct. So we're working on a potential gene therapy for the treatment of Huntington's disease. So it's currently in a phase 1, phase 2 trial.
All right. And how long has uniQure been working or studying the AMT 130, which I believe is the therapy you're referring to, in the lab as a potential therapy for HD?
So the initial research actually started back in 2010. On average, if you look at the industry, pharmaceutical industry, it's about 10, 12 years, sometimes a little bit longer, if it's like a first, what they consider first-in-class therapies. Yeah, so the initial research first started in 2010. So total, as of right now, 12 years.
12 years. What is AMT 130?
The name of the AMT 130 is actually the name of our gene therapy that's being studied. And so you usually give it like some sort of like name like that to just designate it. And then you register that name with the FDA, and we internally utilize that a lot, AMT 130. And so if you were to go into clinicaltrials.gov, you can use that term to look up the actual clinical trials that are associated with that name.
And how is AMT 130 administered to those who participate?
All right, so the interesting part about this is that if someone is assigned to the treatment group, my calendar went off, sorry. It's gonna be actually surgically infused into the areas of the brain under general anesthesia. And so there are a lot more specific nuances to that, but I think for the purposes of the event, we're gonna try to keep it as minimal as possible because we could spend probably like the whole 20 minutes talking about all these different areas. I don't know, Lee, if there's anything that you wanted to kind of add to that.
Yeah, no, we can definitely go more into detail if anybody has any questions. There are plenty of details on our website that kind of explain the process a little bit more. And there's some videos that show how that works. But yeah, it's an infusion into the brain.
Thank you. What is AAV5?
Oh, perfect. AAV5, it's an adeno-associated, so AAV5 stands for adeno-associated virus. And if you are familiar with viruses or different just microbiology, I would say just in general. So there's different what are called serotypes. So different types of that specific vector, or in this case, we're going to call it a vector of that virus. And it's essentially they're naturally occurring, and so they don't cause any illness or infection on their own. And so the serotypes of this AAV5 is one of the several AAVs that are utilized in gene therapy. And so we here at the company, we've codified that a little bit so that it doesn't divide, it doesn't make new copies, or really our hope is that it doesn't cause a large immune response in your body. And so that's what's utilized to actually deliver the gene therapy once it's administered. So
when it is administered, am I awake during the surgical procedure or asleep?
So with this one, so trial participants are going to be under general anesthesia for both the treated group and imitation surgery group. You're both going to be asleep under anesthesia. So.
Am I allowed to have a support person with me prior to and after surgery?
Lee, I don't know if you want to take this one.
Sure. Yes. In fact, we prefer that you come with a companion to help you. They're not going to have to do anything beyond just be there with you and just make sure you get to where you need to be. We do arrange for all of the travel in advance, so you won't have to worry about any of that. But yes, we do pay for a companion to travel with you and the incidental costs that you might incur during the trip.
Okay. So am I going to need a care partner throughout this? And if so, what would be the expectations for them?
Yeah, so you will, but the expectations are just generally that they're with you and make sure that you're alert and okay. And obviously you're going to be dealing with the neurosurgeon and the nurses at the hospital, there is a short hospital stay after the procedure. So they would not release you from the hospital if they didn't feel that you were okay to be released from the hospital. But it's neurosurgery, so you might have some headaches, you might encounter some side effects. So it's just good to have a companion with you in case something as simple as, hey, can you go grab me a glass of water? Or remind me that it's time to eat when it's time to eat, or something like that.
Okay. So how long can I expect to be in the hospital after the surgery?
Yeah, so you'll stay for a day or two. Usually it's just one day, maybe 24 hours. And then if you don't live near the neurosurgical site, then we will put you up in a hotel for another couple of days until the neurosurgery team clears you for travel again. So we just want to make sure everybody's in a good place before we put them on a plane and fly them somewhere or put them in a car for hours. And most of our patients do not live near the neurosurgical sites because we only have 2 right now. So it is likely that you will have to commit to staying for a few days. The sites do have different requirements as far as coming in prior to the surgery, and COVID has messed with that a little bit too. So one of the sites only requires that you show up a day or 2 before the surgery to do all of the intakes. One of the other sites, the other site required, I think it was up to 5 days in advance because they wanted to do COVID testing and clear you before the surgery. So it depends on which site you're assigned to.
Okay. Is this just a one-time therapy, or are there going to be multiple times over the course of my life?
Yeah. Go ahead, Edgar.
So as of right now, it can only be administered once. And really what we want to understand is more about the immune response. And so we're not sure if it can be administered more than once. And so it's something that we hope to better understand as we continue through this process.
All right. Can you please tell us about the inclusion and exclusion criteria?
Definitely. So I'm going to do the inclusion criteria, and then I'm going to have Lee do the exclusion criteria. So we shortened, there's inclusion and exclusion criteria that are a lot more involved. So if you want to learn more, definitely reach out to your local healthcare provider or to one of the referring sites to ask specific questions. So just to get you a little bit of a smaller one. So obviously, we want you to be able to willing and provide informed consent, right? So if you've participated in a clinical trial, there's this sheet that's given to you. It's women and men from 25 to 65 years of age. And so a definitive clinical diagnosis of early manifest Huntington's disease, CAG repeat of greater than 40, confirmed by genetic testing, an adequate striatal volume measured by MRI. And so all HD concomitant meds must be stable for 3 months prior to your screening with no change in any clinical symptoms that require change in medication or prior to the anticipated administration procedure. And obviously that you're able and willing to comply with all the study procedures and study visits, right? And then the exclusion criteria, I'll hand it off to Lee.
Of course, you give me all of the ones with the big words. So our main exclusion criteria is, of course, evidence of suicide risk, patient in an investigational trial within 60 days prior to screening, presence of an implanted deep brain stimulation device, ventriculoperitoneal and other FF shunt or other implanted catheter, brain and spinal pathology that would interfere with the delivery of AM230, obviously, or that represents a significant neurologic comorbid disorder. Any issues with a 3T Tesla or 3T MRI scanner or LPs. Cancer within 5 years of screening. There are some exceptions to that though. And then we have a whole section on COVID criteria. So essentially it depends if you did have COVID. So if you end up with COVID between screening and surgery, you will screen fail. But you could come back possibly and rescreen for the study again. And that also depends on what sort of symptoms you had. As we know, COVID is affecting many different people, many different ways. So it really depends how much it affected your lungs, your breathing, that sort of stuff, because it's a long surgery and you're going to be put under anesthesia. So that is our biggest concern. We want to make sure that we have people that are healthy enough to get through that and not have any issues. So that's it for the exclusion criteria, the main exclusion criteria. Like Edgar said, there is a longer list And you can find that on clinicaltrials.gov or by reaching out to one of the referral sites that are also listed on clinicaltrials.gov.
Great. How long would I be followed post-surgery?
So the surgery, if you are treated, you will be followed out to 5 years post-surgery. If you end up being in the sham group, then you will be followed up to a year when everybody is unblinded after a year. And then it is possible to cross over, which I think you have a question specifically about that later. But if you do cross over, then the clock starts back at 0 with the surgery and then extends for 5 years again.
Where are the clinical trial sites?
Yes, our sites are at University of Alabama, UCSF, University of Florida, Rush, Hopkins, which is also one of our surgical sites, Beth Israel in Boston, University of Michigan, OSU, Ohio State, which is also a surgical site, Vanderbilt, University of Texas, Virginia Commonwealth University, University of Washington, and one of our newest sites that's not recruiting yet, but we've almost got them there, is Rocky Mountain Movement Disorders Clinic. And then we are also working to bring University of Arizona online as our 3rd surgical site. The neurosurgeon that is there used to be at UCSF, where we also did some surgeries, and we're trying to get him set up in Arizona, but UCSF no longer does surgeries.
So if I meet your criteria and I'm accepted into the trial, is there or would there be any financial assistance to help me get to and from any of those sites?
Yeah, so we utilize Concierge for travel arrangements. You'll work closely with the site coordinator at your referral site, and they will ask you for all the specifics of your travel details and I say when you're available, but really the surgical dates are assigned. So you have to make yourself available for the surgical date. But for the study visits, for everything, we are happy to arrange travel. We have participants who travel for every one of their visits, who live hours from the sites, from the referral sites. So they travel for all of those, and we do arrange for that travel. And if they need hotel overnight stay or anything like that. So there is that. We also reimburse up to a certain amount for meals. And I think that's it. And then there's the patient stipend at each of the sites.
If it turns out that I get the placebo, I'm a placebo participant, is there an opportunity for me to actually receive the drug when the trial's concluded?
Yeah, so there is a crossover arm of our study. It won't actually be when the trial is concluded. It will be after you're 12 months out, after your surgical group is 12 months out from surgery. We will unblind, and then for patients who were not treated, they will have to rescreen back into the study. So you have to re-meet all of the inclusion criteria and exclusion criteria that we went through earlier. And if you still meet all of those, then there is the possibility you could cross over. The crossover arm has not been activated yet, just to be clear. We have a DSMB happening this week. So the Data Safety Monitoring Board is going to be meeting and reviewing all of the data that we have. Our first cohort has nearly, except for one patient, they have all completed a year out from surgery. So they're going to review all of that data, and if there's no huge risks, and if the benefits outweigh the risks, then they will hopefully give us approval to activate the crossover arm.
Does participation eliminate me from doing any gene therapies in the future?
This is a big question, right? Gene therapy is permanent, right? And so the treatment with AMT 130 may make you ineligible for participation in future HD clinical studies using other therapies, and that includes gene therapies. I always like to, when asked that question, it depends on the study sponsor as well. As time goes along, each study is going to evaluate their inclusion and exclusion criteria, much like we do for participation in that trial. But it is something to just understand that it is permanent, but it really is going to depend on the trial. So,
okay. With the recent news about ASO therapies, does this therapy knock down any of the healthy allele?
AMT 130 lowers both the normal and mutant Huntington protein, right? Obviously, the effects of lowering normal Huntington protein in levels in adults is currently unknown, so we don't know what happens with that. It is important to highlight that the risks associated with AMT-130 are not yet known. This is the first trial in people. And then once again, just to reiterate that treatment with gene therapy is permanent and can't be removed once it's administered.
Okay. Are there any specific medications that eliminate participants from the trial?
So really any history of gene therapy. So if you've participated in some sort of gene therapy, DNA or DNA targeted HD specific investigational agents, such as like ASOs, antisense, I can't talk, anyways, yeah, ASOs, cell transplantation, or any other experimental brain surgery, usually can exclude you from the trial. But again, if you have specific questions, you can go to clinicaltrials.gov or reach out to one of the clinical trial sites.
Okay. Prior to having surgery, is there any testing or imaging that would be done to make sure that my brain is safe to go through surgery?
If you want to take this one.
Sure. Yeah. So we will do MRI and CAT scans to make sure that your brain's good and healthy. It is a very important part of our study. You can't participate in the study if you don't meet certain volumetrics within the brain. So we are very careful to make sure your brain is the right brain to receive the drug.
And lastly, for our questions, you guys have done a fantastic job, but what safety protocols are in place in case there's an adverse reaction to the drug?
Right, any experimental treatment has potential risks, right? It's a clinical trial, and we're super thankful for those people that decide to participate. And so every effort from the surgery to the follow-up is going to be made to reduce the risks in those studies. We're going to review the results of the tests that are performed throughout the study to make sure that you are that safety is a top of mind. And Lee had mentioned the Data Safety Monitoring Board, so they meet on a regular basis just to make sure that the safety of the trial is first and foremost. And so you're under the care of a physician, right? So that's like the first step. Overall in the study, the data is also being looked at. So if there's anything that would warrant stopping the trial, then or an adverse reaction, then it can be caught at different stages.
Great. Dr. and Lee, thank you so much for being a part of this today and helping others really understand this study and allow them to evaluate their interest in participating. So thank you.
Awesome. Thank you very much, Tammy.
So we'll see you guys in Sacramento, right?
Yeah, of course.
April 30th.
Lee.
In person. Come on, Lee. It's just a short flight. It's a short flight.
It's a short one. Guys, I'm in the middle of hockey playoffs. I can't.
Oh man.
Can't leave.
We got Edgar. That's a short flight. There's no excuses there, my friend.
No, it's like 30 minutes. So it's quick. So
yes. Thank you both so much for coming on with us today and talking to us about uniQure. It means a lot to us to stay updated, our community.